Today we are here to show the evidence that we have generated over the last 3 to 4 years to support the representation of women in leadership in the health sector.
In the context of healthcare, women leaders bring unique perspectives and experiences that can significantly improve health outcomes. To create a level playing field for women in health leadership, a robust legal and policy framework is essential.
So generally, you realize that Kenya as a country, we're doing well in terms of workplace policies and workplace law and laws that affect the workplace. And rightfully so, because we have had a very strong labor unions. But then in terms of reproductive rights, in terms of work-life balance and care work, then we are not doing really well. We know that care work has strongly been relegated to women, and that's where we are not doing well. And so one thing I'd tell a person in decision-making position in government is, let us have these requirements within the law so that enforcement is possible.
I think not only Kenya, many African countries have committed to many global treaties with respect to women empowerment, with respect to inclusion of women in decision-making organs, and there are progress that has been done significantly. Of course, research does seem to show that if women are empowered in the leadership position, they tend to have significant gains to the tune of 10% of GDP in African countries.
For me, workplaces must be safe and supportive. If we want women leaders, the environment has to be supportive to them so that they can thrive and grow as leaders. Secondly, having an ally is critical. Having that someone that you can call, speak about your frustrations about work, having supportive supervisors, having supportive managers and leaders is critical. And I think at APHRC, I've found that we have all that.
I think one key takeaway is that we all agreed on the importance of women leadership. We also all agree that there is evidence to the gaps that are currently in the women leadership in healthcare facility. So there is a need for policy action to address those gaps.
So in a way, a lot of the evidence we've generated is around women's leadership. It supports the notion of multidisciplinary engagement of communities in which we live. It's not just about the stakeholders that we meet here. It starts with us in our homes, but for a policymaker, I think the change that they can make at that level is to be very intentional. So the laws are there to support us. The accountability is needed, but we need to be very intentional.